Hello, hello, hello. We're live from the NHCD Trichology page. Just going to wait for a few people to join. Today we're talking about microneedling therapy, the what, the who, and the why. Let me see if I can get my people here on board to join. If you can hear me, just let me know if you can hear me because I want it to be an interactive session. So the what, the who, and the why of microneedling therapy. Also, let me see. My bio is going to have some information. Sai, I missed you. Look at who's joining. Oh my goodness. Okay. I'm just going to go straight to it because I don't want it to be a long drawn out. Oh, we definitely need to hang outside. We do. I know we're all busy, but there's no excuse. No excuse whatsoever. So let me start. Let's see. Let me see. Background, blah, blah, blah. Okay, so we're going to have some interesting things in my caption later on, but I'm going to go on with the presentation just so that we can make this nice and brief. So microneedling therapy is one of the most popular therapies now when it comes to hair restoration, when it comes to hair loss, alopecia, dealing with any form of hair loss. So today I decided I was going to do this topic because I've been getting a lot of questions on the topic. And also I have been seeing a lot of clients who think they need the therapy, but really they don't need the therapy. So I decided to do this to kind of bring everybody to speed with the general overview of what microneedling therapy is, what it is, who it's for, and why we administer this therapy. So I'm going to move to my next slide. Let's see. What is microneedling? Microneedling is the minimally invasive procedure that is also used to release scalp platelets and hair growth factors in traumatized areas, which help with thickening the existing follicles. So that really is what microneedling is. It's minimally invasive and it's using a needle to prick the scalp so that it releases platelets. Platelets are found in blood and hair growth factors, which will now help with thickening the existing follicles, okay? So the release of these growth factors are needed in the wound healing process, which help with promoting hair growth where there is hair loss or dormant hair follicles, okay? So the growth factors will be released while the healing process is triggered, and that will in turn help with hair loss. So that is what microneedling is. I want to make sure these are the right slides. Let's see. Okay, yes, it's there. Just quickly, no. So I have the wrong slides. I'm going to quickly pause this and get to the right slides. Bear with me because I wanted it to be more fleshed out. So I'm going to update the slides to something more fleshed out, okay? Yep. Let me get it from my computer. Okay. All right. Sorry about that. This is the actual slide that I want to use. It's uploading. But if you have any questions as I go along, please let me know and introduce yourselves in the comments. So this is actually the slide that I want to use. So it's also called collagen induction therapy. Collagen is found on the scalp, like in the skin as well. It's our anti-aging hormone, and it helps with keeping us flush and young. Okay, so collagen is also found on the scalp, and where it's lacking, sometimes the follicles will become weaker and hair loss starts. In the case of like diffuse thinning, and we're going to go into the different types of hair loss that benefit from microneedling. Well, this therapy is called collagen induction therapy because when the needles are going through the scalp, they also increase collagen production on the scalp and help with the releasing of those growth factors. The size of the needles can range from 1 millimeters to a few millimeters in length. Okay, so I'm going to move straight along to the risks. The risks of microneedling. The risks for microneedling include infection because there are needles, so there's a high degree of some kind of microbial activity, and there's blood involved. So sometimes there will be infection if you don't take these precautionary measures, and they include using brand new needle cartridges. They must arrive sealed and properly, disinfected. Brand new cartridges that are disposable should not be reused. And of course, having a consent form where you list out all the steps that you're going to take during the procedure. And of course, you want to look at stuff like this, like predisposed conditions on the scalp. So this is a tiny, tiny, tiny text, but I'm going to try and read it. So who can administer microneedling? So we've done the what. We've done what microneedling is. We've done what the risk factors are, right? Which is infection because of the bleeding. Now we want to do who. So the first who is who can actually administer microneedling, right? So since trichologists are usually not medically qualified to administer drugs or perform medical procedures, some criticism has arisen as to why we offer microneedling service. Now, here are a few points to address that criticism. Microneedling may be used either as a medical procedure or a cosmetic procedure. As a medical procedure, it meets the definition of a medical device, which is intended to change the structure or function of tissue. When used as a cosmetic device, it's used to induce collagen and elastin, as well as aid in the absorption of non-medical serums and healing oils on the scalp. So as a trichologist, when you're using a microneedle as a cosmetic device, you're really using it to help with that absorption of usually non-medical serums. Most of our serums are natural based. They don't have any medicines in them, any synthetic stuff in them. Some of them are derived from essential oils, derived from herbs, herbal extracts, and stuff like that. So we're not administering drugs or medication. Okay, so I'm in Texas, and of course I did my research as to what TDLR, which is our Texas governing board for salons, is. And the TDLR says that there is no cosmetology statute that limits a salon to exclusively provide cosmetology services. Okay, you know what? That text is so small that I'm going to pull it up from my Canva and read it. These slides will be available at the end in a link if you would like them. And of course, they won't be as tiny in text. But let me pull up my own slide so that I can read that properly for you. So the TDR says that no cosmetology statutes will limit a salon from exclusively providing cosmetology services and products. In fact, traditionally, salons have offered many cosmetology services such as tanning and salons have offered many non-cosmetology services such as tanning and body massage. And there's a growing trend in the med spa business. So at these facilities, both medical and cosmetology services are offered. And the cosmetology statutes and rules do not prohibit this practice. However, appropriate training and certification must be obtained. And in this case, it's the OSHA blood-borne pathogen certification that you need to obtain. Now, does the Department of Licensing and Regulation have jurisdiction over all services provided inside of a beauty salon? The answer here is no. TDLR does not have jurisdiction over all services provided inside cosmetology salons. A person is granted this authority to practice certain acts depending on their type of license. Okay? So basically what they're saying is, if you want to offer this service, go and get your certification or your license with that specific service. They are governing the cosmetology aspect of it, and you are to, get your certification for any other aspect. So that's what this says. So who is the ideal client for microneedling? So we talked about the who can administer microneedling. Of course, if you have a general cosmetology license, you can't do this. You have to get trained for microneedling, and most people that get the Trichology certification, there's a actual module on microneedling and services like this for hair restoration. So it's up to you to seek further training and get yourself up to knowledge with that. So now we're going to deal with the who is the ideal client for microneedling. So the ideal client for microneedling is one who has androgenetic alopecia, especially for the miniaturization caused by excessive response to hormonal androgens. So, people that are dealing with androgenetic alopecia, their follicles are still intact. They're just miniaturized. And so that miniaturization can lead to the hair loss. So we're saying if you're using a microneedling therapy that stimulates that blood circulation and helps with regulation of the hormones in that area, you can actually stimulate growth using microneedling where the person has androgenetic alopecia. Let me take a sip of water today. I'm slightly, frazzled. So the next person that can get this therapy is someone who is dealing with alopecia areata, who is usually someone who alopecia areata is an autoimmune condition where we don't even know what exactly triggers the hair to just fall off in that area. Usually is in like a circle form, and I'm going to have images in the next slide. And so where you notice that kind of hair loss, if you encourage blood circulation in the area, it encourages the healing of that area, and that can lead to hair restoration. Someone who has traction alopecia as well, wherever the follicles are still intact and the follicles are not damaged, you can stimulate that area, and that can lead to hair restoration. Also, where there is telogen effluvium, as long as we've addressed the trigger behind the telogen effluvium, whether it be medicine, or you're dealing with chemotherapy or any pregnancy or anything that has led to the trigger of the telogen effluvium. If you've addressed that already, then microneedling can help with hair restoration. So here I have images of the different types of hair loss that microneedling can help with. The first one, AA, is androgenetic alopecia. TA is telogen, is traction alopecia. You can see the hairline, the difference in hairline. Then we have diffuse thinning, and we also have TE, which is telogen effluvium. All these are my clients that I've treated, and I'm going to go into into like the length of time and all that. But these are clients that have gotten the microneedling therapy, because first of all, let me not miss that point. It's non-scarring alopecia. So because it's non-scarring, There's no permanent damage to the hair follicles. The hair follicles still have a root, and the hair can definitely still be triggered in those areas. Now, who is not the ideal candidate for microneedling? Okay, who is not the ideal candidate? The person that is not the ideal candidate is someone who has scarring alopecia. So microneedling therapy strengthens and increases the density of existing hair follicles. Okay, so it doesn't stimulate brand new follicles. We can't generate brand new follicles. We're born with a set number of follicles, and if they're damaged, will you go back to the last slide? Sure. Okay, do you have questions on the last slide? The last slide has images of non-scarring alopecia that can be treated with microneedling. So these are the images of clients that I've had over time that microneedling has worked for. You will see at the very end, I'd give you 2 images of before and afters, but this is just telling you the type of hair loss that can be treated with microneedling. So we have androgenetic alopecia, alopecia areata, traction alopecia, telogen effluvium. Those 3 can be treated with microneedling. I hope you got that, and we're going to move on to what cannot be treated with microneedling. So microneedling will not be treated, cannot treat scarring alopecia where the scars have already been formed. So I always say this: if the scars have been formed in a dime size, or maybe like this size of a circle, and then there are follicles all around here, you can treat all around here so that hair increases in density to where hair now becomes even insignificant because you have all this healthy hair trying to cover it. So you're welcome, Tashara. So, and thank you so much for joining. And so that's what I always say when it comes to, of course, that's not this topic, but when it comes to whenever you're doing a scalp examination, which is another topic altogether, you want to map out areas of the scalp that you'll be concentrating and administering different types of therapy. So on one client's scalp like this, you can do microneedling on this side of the scalp. You can do, hi Samaria, thank you so much for joining. You can do, light laser therapy on another side. You can do exfoliation. So there's different treatments for different parts of the scalp, So you need to know during the scalp examination phase what type of therapies you will be doing on this particular client. So moving on, conditions like lichen planopilaris, they are permanent scarring. Microneedling cannot help that client for that particular spot on their scalp. Discoid lupus, I'm not going to try and pronounce the other part of it. DLE, microneedling can't really help because the condition is autoimmune. And if you know anything about lupus, in the next image, you see lupus, it's scarring alopecia. Then frontal fibrosing alopecia as well. The follicles are closed, and most likely there is nothing that microneedling can do at that point. Central CCCA, central centrifugal cicatricial alopecia. Also, wherever there is scarring, microneedling will not be able to help. Samaria, you missed the part because Samaria actually is in Memphis, and she said something about not really sure she could do microneedling because she doesn't know what her state laws are. So I did go over something that some research on Texas particularly, and on the difference between microneedling used as a medical device and microneedling used as a cosmetic device. So I want you to watch the whole thing at the end of this so you can see the difference and see how you can use it as a cosmetic device in Memphis, if it's possible. Do your own research. But for the most part, it's possible to do it here in Texas. So folliculitis declavans also, because there is inflammation wherever there's pus like this, microneedling cannot be used. So these are the images. So you see lichen planopilaris. There is basically no follicle in that image. It's flat, is almost like skin-like. At that moment, it's too late for microneedling to be effective. Then if you see, sure, please go back to the replay. Yes, at the end of this. Folliculitis, you can see the pus, the redness. You don't want to do microneedling where there is inflammation. You absolutely can't do microneedling where there is scarring, because the scars are already formed in the crown. But as I was saying earlier, if you can do microneedling around to thicken the follicles there, to thicken the density in that area, then you will notice, like some of my clients that have permanent scarring, they will start to see hair grow around the scarring, and to the point where they can put a ponytail and nobody needs to know that they're dealing with crown thinning. Also, frontal fibrosing alopecia like this, the follicles are completely gone. Microneedling will not be effective in this scenario. So also, again with my small text, let me go to my slides. So let me see. Moving on with who microneedling will not be effective for. Let me see. Okay, so yes, so microneedling is not suitable if you have a known history, or if your client has a known history of clotting or bleeding, like hemophilia. You don't want to administer microneedling. That's why that consent form at the beginning is very important, so that you can get the consultation, so you can get the history of your client. So if your client has any form of immune deficiency, like diabetes, uncontrolled diabetes, high blood sugar, you don't want to administer microneedling. If your client takes anticoagulants like blood thinners, such as warfarin, heparin, low dose aspirin, microneedling will not be, you shouldn't administer microneedling. If your client has any form of active skin infection, like bacteria, any form of fungal infection, you don't want to administer microneedling. If your client suffers from hepatitis, HIV, you definitely don't want to administer microneedling. If your client has any form of keloids, history of scars, moles, birthmarks, warts, you don't want to administer microneedling. If your client is suffering from hyperpigmentation, there's a high risk of that becoming darker. So I've had clients that started microneedling and that area became dark, and they of course had to stop the microneedling. Or I'm telling them, so most times the microneedling is not the issue, it's the aftercare where they start to do the derma rolling by themselves, and they're like, my hair has to grow, so I'm going to rub and rub and rub, and it's too much, it's excessive pressure, excessive in terms of how many times they're doing it, and that can definitely lead to, the darkness and hyperpigmentation. So I had a client who started to see like her hairline was becoming darker, and I was like, that's not the goal. We're trying to grow hair, we're not trying to make you, have hyperpigmentation. So we're going to go to, why does microneedling work? So the goal of microneedling therapy is to start your body's healing process by sending collagen and elastin to patch up the tiny injuries, right? So these are artificial injuries. The highest you will see is pinpoint bleeding. You never see oozing of blood. You never see dripping of blood. You just tiny pinpoint injury. So those pinpoint tiny injuries start off that healing growth journey and increases the blood circulation. And of course, with blood circulation comes strength to the hair follicles. Okay, so the needles deliver nutrients from the serum directly into the dermis, aiding in the complete absorption and quicker results. So most times, whenever you're applying any kind of hair product, hair serums with your fingers, you're just working on the epidermis. It's not really getting to the dermis, which is really where the hair root is. And it's just topical, and anything can can just disrupt the flow of absorption, right? So with the microneedling therapy, you're really delivering the serums and the treatments directly to the dermis, or I would say directly because it's not going in, but is going in, is causing those injuries to better absorb the serums. So you get quicker results and you get complete absorption with microneedling compared to when you're using your fingers. So also the vibration from the needling pen, or your whatever pen you're using, you're administering the microneedling with that sustained period of time. So it's usually like 30 minutes to 45 minutes of doing it, and that vibration, that movement, that sustained period of time really helps with creating that scalp massage effect, and really helps with aiding that blood circulation and absorption of products. So that's why we're seeing that microneedling is becoming popular and very effective, because of all these three things that I just listed below. All right. So as I said, this was going to be brief because I really want this to be interactive. So if you have any questions, send them my way. I told you the what, I told you the who, I told you the why, and now this is my summary. If you want to know the how, there's going to be a link in my bio so you can learn, or you can actually see a demo video of how I do this therapy. But microneedling process can be administered with great results, though for best results, clients will need multiple sessions for a sustained period of time. So these are before and afters of my clients, and I want someone to guess for the first client how long it took for this before and after pictures. Did it take 2 months, 1 month, 6 months, a year? Drop it in the comments. How long do you think it took for this therapy to produce these results? Give me a wild guess. Who's here? Who's here? Wake up. How long do you think it took? And then for the second client as well, how long do you think it took for these results that we see in front of us? Let me see. Can I expand this? No, I can't. Oh, I can't expand it. 4 months. Okay. Okay. For the first one, you think 4 months? Okay. Maybe let me give you a few stats. So she is, how old is she? She's definitely 48, I think 48 years old. Onset of menopause. Did she have menopause? Onset of menopause. No scarring, obviously. She has been dealing with severe seborrheic dermatitis, serious scaling. Like, she's one of my clients that has piles and piles of scaling on her scalp, which you can't see it now because we had to go through a whole healing process to where the scalp is in a much better place. And what else can I give facts about this client? She is not on any medication. She's natural. What else? No color. History of hair loss in her family, mother's side, and that's seborrheic dermatitis. Those three things. So with those fun facts, how long do you think it would take for her scalp to start to heal and to fill out like this? 1 year. Yep. So because of the age, her age, as we grow older, we lose collagen faster, we lose growth factors faster. It actually takes longer to. Now, if she was in her 20s, 30s, dealing with androgenetic alopecia, which is what she has, she would have gotten it faster. But it took us from like 8 months, we started to see the results. And 1 year is more likely and she used to come twice. She actually was very intense. So for the first 6 months, we were doing this twice a month. every 2 weeks. And then we weaned off after 6 months to once a month. And so by that, after 6 months, by 3 months, her seborrheic dermatitis is under control. Not gone, not completely gone, because these things are genetic. So what we do is we manage them more than completely eradicate them, because most times they can be completely eradicated. So we managed it to where the scaling wasn't getting in the way of the oxygen flow, the blood circulation on her scalp, and the serums were penetrating to her hair root and strengthening her hair. So that is that client. The client on my right, she's 45. She started dealing with this hair loss from tight ponytails. You did a different treatment for her. Yes. So for seborrheic dermatitis, it's a complete different protocol. I'm really just speaking to her hair restoration here, but you will see how other conditions can contribute to hair loss. So, the seborrheic dermatitis was to the degree where the scaling was actually pulling out hair from her crown, and she was losing hair. And most of my clients that deal with seborrheic dermatitis, most of them also have that hair loss. I mean, the severe ones, hair loss side by side, So yes, the protocol, the therapy for the seborrheic dermatitis is different from microneedling. Microneedling helped with thickening her hair and increasing density on her scalp. So the other client, she is in her 45, I think. And she's been dealing with hair loss for a while. She does have hair loss in her family. She actually also had, just making sure. She also had tight ponytail. She said she used to do when she was in her like 20s, 30s. That was her go-to style. A lot of tension and I actually, when I first met her, I actually thought, oof, what did I just do? I actually thought she had CCCA. I actually thought that this was scarring, especially down the middle. I really was like, there's no way this hair will grow, right? I was like, this might be permanent scarring. But after I noticed that she was having like pitch fuzz, I was like, okay. After like 2 months of like just doing like detoxes and doing like scalp stimulation just without microneedling, I noticed that pitch fuzz. And then I did there is a spot in her scalp, and Elo is here. Elo, I don't know, can I add you to the stream? So Elo is my trichologist in training, and Elo actually was with me last week when this client came in. She's the client, Elo, she's the client that we were trying to find her scar. That's the client. If I can add you to the stream, let me know if you're up to talking. But yes, I would have thought it was scarring too. Yeah, ponytail. So honestly, I thought this was scarring. I thought because of how the way it was, the positioning it was, but it was really more of traction. I'm telling you, when we completely took the traction out, and and of course she has hair loss in her family, so I think it's contribution from also androgenetic alopecia as well, especially because of the positioning of the hair loss. But I'm telling you, the traction was really the main contributing factor with this client. And Miss Ella was with me last week, and she has this permanent scar from the ponytail pin, but we were looking for the scar. I wish I could. I'm going to add you, Ella, to the stream.
Can you hear me?
Oh, good. Yes, I'm adding you to the stream. Please tell me about what we were doing last week when we were looking for her scar. Do you remember this client?
Yeah, I remember the client, the lady I did the cornrow for.
Yes. Tell everyone how we were looking for her scar.
Actually, we were looking for her scar because I was trying not to do the parting for her cornrow,
yes,
on the scar area. And so we were looking for it actually, but we couldn't
Yeah.
find it. So I just put the part in the place where she can actually just do demo
The
rolling.
demo. So can you believe that this is how her scalp used to look? You know, remember I told you I would show you
Yeah,
how.
you were looking for the picture
Yes,
last week. Yeah.
yes. So this picture I'm showing you as her after, there's even an after, which is what Elo is talking about, where her scalp was filled in even more than this. And you can see, so how I know the scalp is starting to fill in is when I do the cornrows and I'm able to see that the parting is not as wide as before. So of course, taking pictures is always a very good way to so Ella, I'm going to release you now. Do you have any questions or contributions to this live?
So far, no. Just listening.
Okay. All right. Thank you. See you this week. Okay, so these are the ways that we can really help our clients when it comes to hair restoration. Microneedling is one of my favorite ways to do it, but I've had to really do some research. I've had to take my time and learn and figure out ways to really help people with their different conditions. So I'm really, if you guys don't have any more questions, do you have any, Miss Barbara? I see you. Do you have any questions or contributions?
No.
No, you don't? Oops. I thought you were about to say something. I couldn't hear you. Okay. So this slide is going to be added to our module on the platform, Ms. Barbara. So you definitely be able to have this slide as well as any other questions you might have. But so that is a summary of the who. Let me go back to my first page. The who, the what, and the why of microneedling. Yeah, the what, the who, and the why. So if you want to know the how, there will be a link in this video caption, and you'll be able to access just a brief, concise video. Now, if you want a full handheld journey through becoming a trichologist and really doing this as a profession, because it's really a rewarding field, then I definitely have a link in my bio or in my caption that will lead you to that information. Also, I have more resources on that link that can help you if you're in search of equipment and you're looking for or a kit on how to start your trichology career. There are links for all of that on the link in the caption. So I want to thank you guys for joining me. I want to be doing this monthly. If you have any topic for next month, let me know. You can send me you can write it here, or you can send me a message. I'm going to leave my email, and we can talk about something else that is in the hair restoration field. All right, Tashara, I will be happy to help you with, setting up and creating a flow, because that's really essential with trichology. There has to be a flow, and that's what I've been helping Miss Barbara with, Elo with, and a number of people. I'm not perfect by any chance. I'm also learning and shaping and molding. So I will be happy to get any feedback whatsoever, what you think I need to add to my success in trichology course, what you think I need to pad up. I'm actually going back there to add more things, including this slide, because I want us to have all the information that we can possibly have to help our clients. I don't want our clients to ever leave us thinking, what did I just pay for? I want them to feel confident that we will get them the results that they desire. I want us to be able to team up with dermatologists and for dermatologists to respect us because they see our work and they see that we are efficient and we're delivering results, right? So if you have any questions, if you want to be part of my community, the Success in Trichology community. I have all my links in my caption, and I look forward to connecting with you guys. Next month, I'll be back. I don't know what topic yet, but I will find something and we will discuss on this topic. So thank you again. And if you miss any part of this live, be sure to watch it back. Thank you and enjoy the rest of your week. Bye-bye.